anesthesiologist is now called as the perioperative physician. He is jack of all, and if you are really good, you can be the master of all. You are the jack of all because none of the subjects that you have studied in your MBBS is going to be of waste in this specialty. Your anatomy, your physiology, your biochemistry, your pharmacology, medicine, each and every subject is useful, and you will be in touch throughout your life about these subjects, because you need to know a lot about anatomy, the physiology, respiratory physiology, cardiac physiology, everything, drugs, each and every drugs, and surgical aspects definitely. So that is the important of you being an anesthesiologist. Now, what is the scope for anesthesia? Yes, you can be a general anesthesiologist in a medical college, you have a scope in a corporate hospital, and more than that, you can be a freelance anesthesiologist. You are required in every areas, whether it is a rural area or in a taluka hospital, whether there are bigger corporate hospitals are there or not, your service is always required. And of course, in a medical college, you in the operation theater, you are the boss. You are the boss because you many a times you will be guiding the surgeons also. But unfortunately, the credit is taken by the surgeons. That is little shortcoming of the specialty of anesthesia. Now, is it only that aspect of anesthesia? No. You have super specialization like things. You can be a cardiac anesthesiologist by doing a fellowship. You can be a pediatric anesthesiologist, transplant anesthesiologist. You can be specifically practicing with the regional anesthesia, or most importantly, you can take up the specialty of critical care medicine, where you can manage with the ICUs. And to start a practice, the physician was telling you need to have just a table and a stethoscope, but even that is not required for us. You don't have to rent a clinic, you don't have to pay the receptionist's pay. Only thing is you need to be good with the surgeons, and you should be constantly in touch with the surgeons. You are many times there is a lot of scope to learn skills. You are the boss of skills, and present day you have the availability of ultrasound. So you can use ultrasound for everything, including nerve blocks, epidural anesthesia. You can give for post-operative pain the facial plane blocks, and in the ICU you can use ultrasound to diagnose what is wrong in a very fast manner. It is called as fast focused assessment by sonography. In the casualty also your involvement is there in diagnosing trauma. So all these things are there. Now, what is the disadvantage? Yeah, as I told, the little disadvantage is your role is many a times not very much recognized, especially in the society. The credit goes to the surgeon, and even if it is a very difficult case, patient has some problem in the intraoperative period, you manage well, but still the surgeon takes the credit. The other aspect is lot of stress. Yes, our specialty is considered as what we are doing is like moments of hours of boredom and moments of terror. Yeah, it is like that. Surgeon go on doing the surgeon. You have to wait. Suddenly there is bradycardia. Suddenly there may be a bronchospasm or a arrest. You have to be very, very alert. That is the stress. The other stress, especially if you are a freelancing anesthesiologist, time management is the main stress. Okay, some surgeries unexpectedly goes on, and if you have a tight schedule, you are delayed for the next surgery, and the next surgeon is angry with you. So you have to take the burden. That is the main problem with so you have to be round the clock available. Yes, who is the good fit? Yes. If you think that you have to be very, very person who is socially recognized may not be a very thing, but you want to be with the all the specialties, all the subjects, and if you want to be very good with all the techniques, yes, anesthesia is definitely a very good specialty where there is a lot of scope. You can start earning on the next day. This is not possible with any other specialty. They have to wait for at least a few months for their patients. But if you are in good contact with the surgeon, next day you will be doing 5 to 6 patients and doing lot of money.
High demand, yes, no doubt. The demand versus supply. The supply is not matched because every year more and more and more of centers are being set up, more and more emphasis on diagnosis, because patients nowadays need evidence-based medicine. So even if a patient comes to casualty, no doubt the surgeon will see the patient first, but within the next 5 minutes the patient is in radiology. So they undergo what is called as CAP. Abroad they call it CAP, that is chest, abdomen and pelvis, or sometimes head, cervical spine, chest, abdomen, pelvis, CT. This is what is followed all over the world. From the ER, straight away the patient is wheeled in, and from the head till the thigh, they do a CT scan. So that is almost like 3,500 images for us to go through. So that takes time. So luckily here we are able to have a TAT and we are able to give quick reports, but in many places the reports take a long time. Of course ER reports are given fast, but if you do an MRI for something which is not really an emergency, you might need to wait for probably a month to get the report in many countries abroad. So that's where the teleradiology also has come in the picture. So high demand, lucrative salary, yeah, no doubt. The minute you pass out, there is demand, and in fact there is even in colleges there is a separate pay scale for radiology department, which most other departments don't know about. So so that's how it is usually negotiated. And the good work-life balance is something which I really don't agree with. Good work-life balance comes at a cost, like in other specialties. Of course you can say I stop at 5 or I work 9 to 5, that's it, I'm not reporting any more cases, you can shut down and go. But then that comes at a monetary cost, so it's up to you to decide what you want to do. But okay, even in those 8 hours, it's pretty good. And technology driven, so that is the main thing. You need to be e-savvy, you need to be tech savvy to be in this field. Technology is there, technology is already there, and technology is changing almost by the hour. We are getting newer and newer machines with newer and newer software and newer stuff added to it, and you need to really update yourself, otherwise you are going to be obsolete. Convergence of diverse fields and a roadmap for other specialties. So other specialty doctors keep coming to radiology to discuss with us because we lead them where they need to go. For example, a surgeon might make a diagnosis, and if the radiology kind of corroborates, he's really happy, and if he has seen the CT scan as well, then he really knows what to expect inside the abdomen. Most surgeons have gotten used to seeing the SAG and coronal images, so they know exactly what to expect when they go inside, or even a neurosurgeon or any surgeon for that matter. Work from home or remote options, that is teleradiology, which I said, but it is boring, no doubt, because you are in a job for various societal interactions as well. But if you don't mind sitting at home, it's like a work from home IT job. You just have to open your laptop at a particular time, you do this many cases, and at the end of your time you shut down. You can say I won't do night calls, then obviously you will get paid only so much whatever you do per day. But there are people doing full-time teleradiology also. I mean, they don't work anywhere, they just sit at home, they open their laptop and they shut their laptop when they're done, and they tell them I'm signing off, that's it. So it's very similar to an IT job. Less complications and litigations, well, that is with inverted commas. Less exposure to violence by patients, yeah, maybe, because we are most of the time hidden in some reporting room and it's hard to find the radiologist, and most of our departments are very dark. Where we sit is usually dark, so it's really tough to find us if they need to come after us. And high demand for female radiologists, especially in many countries, they specifically ask for female radiologists. So, in fact, there are colleges in Mangalore itself which offer a higher salary for female radiologists than male radiologists. So that's how it is. Yeah, the last thing is added. We are in the coolest place of the hospital. So as you can see, I'm really sweating here. So our temperature is always maintained at 18 degrees. So we work always in 18 degrees centigrade. So many people come and sit in radiology just to enjoy the AC when it is really hot outside. They come saying they want to discuss a case, but they linger around for at least half an hour. Okay, next, demerits, expensive training. Yeah, either you should be really very bright to get into radiology, or you should have a hell of a lot of money. So one of these two. And constant skill and knowledge updating is required. And limited patient interaction, which sometimes is less gratifying, but always a good radiologist would always take a good history. A good history leads us to a diagnosis better than what we see on the images. Most of the time when we do an ultrasound, we keep talking to the patient, or even before a scan. We just talk for 2 minutes to the patient, we almost know what the diagnosis is. So it only helps us. So we shouldn't say that history is not part of the radiology. We need to always take a good history, especially because the referring consultant sometimes doesn't give us the required information because it's only a reference slip which is sent. And it's a competitive field, and whether AI is threatening radiology, there is some concern which most people who have taken radiology are saying. AI will kind of complement radiology. It will probably not supplement. But yes, there are some corporate hospitals already in Bangalore and all those places where all X-rays are reported by AI. There is no time for a radiologist to look at the X-rays. So what the AI does is it sifts the normal from the abnormal. So that much the AI can do. After that, only the abnormal X-rays are put for report to the radiologist. All normal X-rays are passed off by AI as normal. And it is slowly happening to CT heads as well, where the numbers are more, AI is taking over. So I wouldn't say it doesn't threaten us. It can threaten us to some extent, but not completely. And if you are really e-savvy, you can even get into AI. There are people of my PG who got into research into AI, and they are working for AI companies, helping them build software, and they already were very e-savvy, and they were already technologically very bright. So you can get into the field of AI as well. So there are courses for in AI and ML available for radiologists also, or for all clinical fields. Yeah, those with detail-oriented thinking is a good fit for radiology. We need to have an eye for things. So we are like the Sherlock Holmes who see what others can't see. That's what. So we need to really be searching for things which others cannot see. And strong analytical skills, of course. Finally, it is all coming down to a diagnosis based on deductions and coming to a conclusion. Those with less communication skills can also survive, no doubt. The only people probably you need to communicate with are the doctors. So may not be with, so you can still survive pretty well. And good work-life balance, of course, coming at a cost. And those who seek instant gratification. Yeah, in the beginning, the salary looks very good. So soon after you pass out, you get good salary and all that. But in the long run, like you said, for the surgeon, the sky is the limit. There is absolutely no limit for the earning a surgeon can do. You just have to operate probably 1 case a day. That's it. So in instant gratification, no doubt, but the growth doesn't happen that way. So 30 years down the line, you might still be earning double of what you started off 25 years back. So that's how it is. And those who hate paperwork and lengthy documentation, that is basically we don't write case sheets unless you are in intervention radiology. So we don't write any case sheets, so no paperwork. So everything is on the computer. So the whole reporting room looks like what you call IT office, yeah. So most of our reporting rooms have just Mac monitors or something. We just sit in front of them and report. And you might have some concerns about radiation, but actually those are not really a matter of concern. I feel cardiologists take a lot more radiation than us because they are in the cath lab, and intervention radiologists, we hardly get into the radiation areas. And nowadays the most machines are designed pretty well such that there is hardly any scatter radiation. The radiation is only to the particular part where we are doing the imaging. And so that's about it, and it more or less answers all the questions what you might be having about radiology.
Coming to dermatology, I was just listening to many of my colleagues who spoke on. Dr. Anand said, if you want to be a glamorous practitioner, take up surgeon. If you want glamorous patients also, take up dermatology. So that's how I put it. You want your patients also to look like Aishwarya Rai or John Abraham, you have a field here, dermatology. Of late, the radiology, who spoke just before me, and dermatology, whose demands have gone up in the last 15 to 20 years, primarily because of the devices have come in our field. So these devices have made us very worthy. And other thing is something very common. When he was speaking, I thought it's a dermatology he was speaking about is AI. So AI or remote diagnosis has also become very common in dermatology. You just need pictures. There are a few of my colleagues who are not practicing much in their clinic, especially after the COVID. They were really scared of COVID. They all stopped their clinic, closed their clinic, and they went into AI, and now they have become very lazy. They are only doing AI-based, they are doing remote diagnosis, which we call it as teledermatology, or they are very busy in their OTT platform. So that's how the life has been for many of us. So it's an advantage, but I feel it's a disadvantage. But first point I would put it, work-life balance is much better. You want to be in everywhere. In social life, you want to achieve something, you want to take up leadership role, you want to do clinical trials, you want to do many other things, you want to be in Lions Club, Rotary Club. Here you have a field. Being a clinical field, it gives you a fairly good amount of that leisure time wherein you can have a very good work-life balance. Of late, I see most of our PGs are ladies. I think that must be the reason their work-life balance is relatively better. I think my UGs are also mostly girls only. So I think that is also another reason why the number of ladies taking up. Earning potential with minimally invasive work. You don't need very great skills, honestly speaking, when it comes to, I'm talking about monetary aspect. Because monetary aspect basically comes from the invasive things, a little bit invasive things you do. You don't need a great, skills. I'm talking about diagnostic skill. Definitely you need a very good diagnostic skill. But when it comes to the procedural skill, you don't need the amount of skill that probably a cardiologist or interventional cardiologist or a radiologist requires. But with relatively lesser amount of training, which all that you need is 3 months of training. So you can take it up, that's a merit, but it's a demerit also, I'll come to that later. A rapidly advancing field, both in terms of the clinical dermatology as well as the procedural or the cosmetic or aesthetic dermatology, what we talk about. I'm not going in depth of that, but because you all know. Is rapidly advancing because we are getting a lot of precision medicine when it comes to clinical field. If you ask me who use the most expensive medications, I think to use an expensive medication, when you use expensive medications, your patients take you very seriously. If you are using a biologic, an injection costing about 1.08 lakh, a single injection. I use rarely though, in my patients I use dupilumab. An injection costs 1.08, I import it and give it. I give secukinumab, an injection costs 30,000 rupees. Of course today I think antibiotics are also costing so much. But other than the rheumatology and probably oncology, the third people who use maximum number of precision medicine, biologics or the small molecules is the dermatologist. So you have a thrill in using this medication, not because they are expensive, but the patients take you very seriously when you take up these things. So you have a rapidly advancing field, both in terms of the clinical dermatology, but also in terms of the advancements that are happening because of addition of a lot of devices. You call them lasers, you call them scopies. I remember long back, when I was seeking a prospective bride, my parents rather, I was rejected saying that dermatology no scope. I just take it as a joke. Today after 25 years, we have so many scopes. We have dermoscope, we have transilluminoscope, we have what we call, what is coming up in big way. We have trichoscopes. You see patients take you very seriously. You put a machine on their scalp and diagnose their hair problem. They're very happy. We call it as trichoscope. We have video trichoscope. You can show them also, look, this is the anagen hair, and they're very happy. They're impressed. I'm sure they don't understand anything. So it's a good thing to do it. You put a scope and diagnose, and you can charge that additional scopy charge also. So that's a thing. And we have next big thing is coming, that is called the confocal microscope. In vivo visualization of what's happening under the skin. The confocal microscope is the big game changer in dermatology in future. So you have many scopes are there. So what I refer to the scopes are different scopes. So scopes you put an extra money. I'm not just talking about the monetary part, but also about the scope of practice, the demand and stable opportunity. I think in the last 15 years, I see the demand has not gone down. We have both in terms of pure dermatology patient and cosmetic practice both, thanks to the social media and OTT platform, everything, which is increasing the demand for the cosmetic practice, but at the same time, you also have a very stable dermatology because of the quality of life issues which are involved with dermatosis, the chronicity of the diseases, pruritus, visibility problem. Nobody wants to have a bad skin, so that's the thing. Yeah, now coming to the demerits, it's highly competitive and expensive field. As was told by radiologists, you need a really high merit to get a dermatologist seat. Although that is slightly dropping in the last 2 years when I see 30 people from the 100 rank sometime back, PG NEET, they took dermatology. But that has gone down last year to 13. That means that part is slightly, getting this thing, because slightly saturation, especially in the cosmopolitan and bigger cities it's happening. It's a competitive and expensive, because if you want to earn that additional money, buy devices, you have to buy your devices, unlike radiologists. The hospitals will buy for them the machines, but for us, we have to buy. But now slowly, many hospitals are buying it and they're employing dermatology. That is in the face of trial. But that has a negative things also, because once they will give you only, peanuts, the corporates, and they earn the maximum. So that is always there. That part is always there. Lack of thrill due to low admission rate. You don't have a lot of admissions. That's something which is, but when you get an admission, they're really bad ones. You have these toxic epidermal necrolysis. They're really bad. The mortality is also relatively high. You have bad pemphigus patients admitted mortality. If you understand, people talk about, medical indemnity. If you see the highest ever paid compensation was by a dermatologist. It was close to 10 crore rupees, one of the case, wherein, hospital and the dermatologist together, they had to pay. So you have, absolutely there is a high risk, but that number is small, and then there's a high initial investment, as I just said. So you have an investment if you want to have a beautiful looking clinic. You want to attract patients as well as clients. So there you have this. The next thing is high patient expectation. This is another problem. This is a challenging thing. 2 reasons. Number one, they come with a picture of the most beautiful Bollywood. I should look like this in 2 months, because in 2 months I have my wedding. So that high expectation is there with the patient, and it's impossible to satisfy them. Number 2, the second part, the hidden thing which is behind, many of these patients are dysmorphophobic. That means they have a very bad body image about themselves, and treat them itself is a risk. And you're going to have midnight, you're going to get WhatsApp calls, you are going to get WhatsApp messages and all that. They are going to ruin your life. That is another problem with dysmorphophobic patients. You are going to deal with them, and high risk of litigation is there, as I said, because you are also getting into cosmetology practice. A patient who gets into the clinic, his bill is going to be 30,000, 40,000. If you're not 30,000, it can be much more than that. If you're putting 2 injectors, the intradermal injectors, the dermal fillers, the cost is going to be 50,000 or 60,000. And these are the patients who are going to pull you to the court, and they say, I was looking much better before putting this injector. So you want to earn money, it comes with a risk, so you always take a very high indemnity when you're practicing dermatology. So now coming to who is fit. Preference for work-life balance, which I already said. You want to be in everywhere, then you have a field here. Preference for the independent practice. That is one of the very nice things. I don't want to go around and meet people and send me patients, send me referrals. You want to do an independent practice. You don't want to be bunched down to any pressures. You don't want practitioners to refer you cases. If you're good in your skills, they will refer. In Mangalore, definitely, I'll tell you, you don't have to do all these things. They will refer. If you're good in your skills, they will refer you. So you have here your academic interest and knowledge sharing mindset. You have an academic interest, you can publish a lot of paper. You get that additional bit of time wherein you can sit and write papers. Willingness to invest on devices. If you want to like to invest on devices, you have a lot of, many people I've seen, many of my friends who invest on devices, they also buy good cars also. Basically, they have that, machine loving thing. Some of us have pet loving. Similarly, we have a category of people who love machines. And those are the people who take up dermatology. And I have a friend in Sholapur. He opens that machine, he knows everything about it. If I have any problem with my machine, I'm not the machine, I can call him, he knows it. So you love machines, you have a field here, and business and entrepreneurship. This is the last thing I'm keeping it, but you understand, you have a sky is a limit if you can explore it as an entrepreneurship. I have at least 10 or 15 friends, they have chains of dermatology clinics. Just like ophthalmology probably has that advantage. But dermatology, he has 15 clinics. I have a friend in Surat who has 26th clinic he has inaugurated recently. Sakia clinic, you must have heard about it. 26th clinic, they're not that popular here. 26th clinic. So he just does a bandmaster job, and he's actually not there in any of the clinics. He has employed people and he earns. Sky's the limit.
You might be confused in what to take and what not to take, isn't it? So how I took it, I said, I started understanding what I should not, definitely not be taking. Finally, then I can be happy and satisfied in whatever I take. Because you may aim at something, and if you don't get it, you will be kind of miserable throughout your life, which you should not be. Because anything you take, you should learn how to love that subject as well. And ABC of practice is one thing you need to keep in mind. That is availability, behavior, and competence. Okay, this is in that order. You need to be available all the time in any specialty if you want to be good, and your behavior should be good, and only then the competence actually comes into play. And you may be the most competent. If you're not available and the behavior is bad, nobody is going to refer you patients, and no patient is going to come to you, isn't it? So that's one thing. And second thing, money is a given in any field. As in, if you are good, there is enough money in medicine, and you don't have to worry about that. So money need not be the primary criteria for you to choose a branch, is what I would think. Of course, if you want to really high ends, of course there are some specialties which can give you more, but otherwise it is not. And every specialty is indispensable. Again, if you are a good pathologist, then you are the Supreme Court, because every surgeon will bow in front of you to get a report which is actually reliable and dependable, so that my patients go home better. Okay? And all you need to do is that it is not that what is good and what is bad. It is to check whether I will fit into that, whether that suits me in my own settings, is what you need to decide out of this, the meeting what we are having it here. Because this will actually help you narrow down your, your ideas, and narrow down your choices, so that you can make a good and informed choice, so that you can actually be lead a more happier life. And coming back to, of course, my own specialty, good work-life balance is, everybody has been talking about this. Is one of the talk of the town nowadays. I think everybody talks about it in social media, because if you need spare time for social media, you can choose ENT as well. So that's how we look at it. Sorry, I think I will have to go through some of the things which I had shared earlier. There is a variety of options possible to do that in the balanced work-life balance what you can have, because you can have the most stressful part, which is the skull-base surgery or the pediatric airway surgeries, where every minute and every second counts, to the, as in, you can say it's the least demanding. You can practice allergy, you can practice vertigo, but still be one of the best in the field in the entire country, and you will be well known, as in you will get movie stars and the politicians and anybody who will be, of course, all people are ultimately humans, and they will have some problems, and they are likely to come if you are the best in that field. And good remuneration to sustain your almost all your needs, which I said, as in it is there in every field. It's not just ENT, and ENT is not without it either. So let me say that, I'll put it that way. And only thing is that if you are joining into a medical college and things, of course it's a little different, because this is kind of a stepsister type of specialty, where you won't get what you want to practice. There will be many instruments which you may be trained in using, but the institution should provide it, be it a corporate or be it a medical college, because they will always invest maybe in a 2 crore rupees microscope for a neurosurgeon, but a 5 lakh rupee microscope for an ENT surgeon, they will think twice. So that's the kind of thing which happens if you are going to join into a medical college, or if you are going to join into a corporate, because this has always been the concern everywhere across the country. Of course, it is not so anywhere else in the world, but this I'm talking particularly if you are choosing to stay in our country, which I hope you all will. Okay, so few other things which is interesting in ENT is that if you're kind of confused in whether you want to would like to be a physician or a surgeon or a radiologist or not, then ENT is okay for you, because you can practice surgery like in head and neck surgery, cancer surgery. You can have 8-hour surgery. You can include plastics as well. But at the same time, you can sit and operate on a microscope, and for 8 hours again, being a ear surgeon, no blood at all, and it is almost like a carpenter. You will be sculpting, and of course, it's a very rewarding both financially as well as from the patient's point of view as well. And same with the rhinology, you can have a bit of both. And if you can advance the rhinology, you can go into this endoscopy skull-based surgeries where we collaborate with the neurosurgeons and do things which are the transcranial, because the pituitaries, the CSF rhinorias, and many of the tumors which are at the skull base is something we deal with. And both inside the cranium and outside the cranium. But that's called as a skull-based surgery. That's a very interesting and developing field. Of course, it has got its own perils. We are almost always dancing with the carotids, internal carotid basically. So that's where the scary part comes as well. But these are the things which are there everywhere. And you have the cosmetic side as well. You can practice rhinoplasties, the cosmetic part of the ENT, the facial plastics. These are all subspecialties of ENT. There are some 8 or 10 subspecialties in ENT which keeps coming up all the time. Okay? And even to the finest extent where we are starting to practice dacryology, where it is only the epiphora, that's the watering of the eyes. We collaborate with the ophthalmologist, and then we do something from inside the nose, and where they help us from outside as well. So another thing, we can call it as a merit as well as a demerit, is that we have to interact with several subspecialties. We have to interact with the pulmonologist if you're a sleep medicine specialist and you're dealing with the snoring. You have to interact with the neurosurgeon if you want to skull-based surgery, and if you want to interact with head and neck cancers, you need a plastic surgeon along with, and there is a maxillofacial surgeon when you're interacting with the trauma. And bear in mind, when you say you collaborate, and each of these specialties can eat away into your fields as well. That's also the thing which is there, because we almost always keep competing, as in the head and neck surgery can be taken over by the oncosurgeon, and neurosurgeon can learn the endoscopic side and they can take over the endoscopy part. All these things are there. But having said that, as I said earlier, if you are good at whatever you are doing, there is always a room for you to prosper and progress. Okay, that's what you will have. So, and of course, finally, you can have a bit of everything in the old style ENT practice. Now it is no longer ENT head and neck surgery. There are so many ways, as in finally we are now choosing to call ourselves either an otologist, a rhinologist, or a head and neck cancer surgeon, or a laryngologist. So much to say that even the laryngology field itself is almost starting to separate itself from ENT. Because the laryngology has got airway surgeon, a dysphagia surgeon, and a voice surgeon, the phonosurgeon as well. Because there are 3 subspecialties in the within the subspecialties as well also is developing. Because that is there is scope for everything everywhere. You just have to choose, and actually you can kind of improvise, and you can actually migrate from being a general ENT surgeon to an otologist or a laryngologist, and from there you can become a phonosurgeon. So these are the things what you can actually explore doing those things. Few cons is that, as in what I would like it not to be there, is that as one thing, it's a very shallow, as in when I say shallow, it takes a long time for you to study, as in learn these surgeries, because it's a very minute, tiny area. Ultimately, anesthetists and everyone else in the theater will be thinking, what am I doing for 4 hours and 5 hours doing a mastoid surgery? And ultimately, when I come out and show the patient that it's only about tiny 5 by 5 millimeter specimen, calling that as a cholesteatoma, they wonder, as in, what did I do for 5 hours? But if I need to give a result, every minute of that 5 hours is important, and that takes time for us to learn. And it is a demanding surgery in that. And in India, especially in South India, there is almost all the hospitals where you go into. I get many of the postgraduates who are just qualified come in and asking, as in, is there an opportunity to kind of learn in my clinic? Because all the reason is that all the hospitals are full. Even the smallest nursing homes, there is an ENT surgeon everywhere. So that is a kind of thing where it has gone into. But yes, of course, if you are stopping at being an ENT surgeon, general ENT surgeon, it is difficult for you to kind of climb up the ladder. But if you do the fellowships and if you do something in advanced in ENT, one particular small area, there is always room everywhere, be it in Bangalore or Bombay or the New York or anywhere, because there is always a scope for all these things. Competition with the other branches I talked about. And one thing also is that it is difficult to get positions abroad. As in, if you want to go somewhere in the developed, so-called developed world, so that's European or the North American countries, and this is along with the ophthalmology is one of the most sought after. All the locals want to do this because of the good quality of life. And if you are in Europe, where it is mainly the salary-based system which is there, and generally ENT is the first one to go. It is mainly because in the salary is the same. Why take up cardiothoracic surgery and get all the stress along with the same salary? So whereas you can practice otology and have the equal amount of money as well. And but in the US, if you go, it is more of as more like ours. Rather, we adapted their systems where we can have private practice. We can have lot of patients as well. Just to give an example, 20 years ago when I was doing my residency, one of my fellow residents who was doing radiology went to the US. He used to come back to India. Whenever he used to come to India, he would come and get his indirect laryngoscopy done, which is free of cost, just a part of the ENT examination. Those days, 25 years ago, it would cost $150 just for adding that indirect laryngoscopy. That's how expensive it is. That's when it is expensive to the patient, you can realize that it is rewarding to the person who is doing that as well. Therefore, it is very, very highly in demand. It's very difficult to get that when you go abroad. And you need to kind of work your way all the way up. As in, you might have been an ENT surgeon here, you have to start as the most junior most surgical trainee and then climb up the ladder. Okay. And who will fit into the profession? Sorry, the third slide I'm already in.
Yeah.
Oh, is it? Okay, yeah. Basically every doctor, as I said, because there is so much of variety in that, as in if you are confused, join ENT and you will kind of fit somewhere, that is for sure. And a person who is willing to learn, as in you need to keep constantly learning. Of course, this is true for any field and every field, because if you are, as in, otherwise you will rust and you will be soon out of the race. Necessary qualities is that there has to be keen interest to understand a very narrow corridor, because be it a skull base or a nose or anything, it's a very, very tiny corridor, unlike in general surgery or thoracic surgery or anywhere else. And it's a very, very narrow area which we are dealing with. Therefore, it's a millimeters will make a difference between life and death as well, and the results and failure as well. Okay. And a person who is willing to interact, it is very important, because obviously you can't be master of everything, starting from neurosurgery to the dental areas and the ophthalmology areas and all those things. You have to leave those areas to those respective specialities. Therefore, you should be good at interacting with those people and getting the best of both the specialties for the betterment of our own patients, because ultimately it is not my patient or your patient, isn't it? Ultimately, we are all working together for a better result for the patient. Desire to invest is an important thing. Of course, if you are investing, I think I could have owned 5 Mercedeses by now. So probably, because that's how much of investment that goes in if you're in the private practice, starting from the microscopes, the endoscopes. Each year you go to a conference, there is a new gadget which is costing 25 or 30 lakhs, and without which you are soon out of the race, because someone else is going to invest on those things. And also it aids in our diagnosis, and if the diagnosis is correct, then obviously the treatment is going to be better, isn't it? So therefore, it kind of becomes imperative for us to invest and to kind of go to the bank, keep running to the banks again and again to get some extra loans.
So Madam was talking about the gift of life and how gratifying it is when a child is born, how gratifying it is to take care of the mother. I would say it is equally gratifying to give somebody sight. You might have seen ads where people are walking blind and they do surgery and next day everything is fine and they are so happy. That is actually true in our clinic. Okay? So you do a surgery and the next day patient is very happy. The downside is that you don't give that expectation to the patient, and they have very high expectations of you. So they want to see everything clearly the very next day. So we are a very elite, very demanding and equipment heavy, as sir said. So all those things apply here as well. Now, yeah, one of the main advantages is that you get to be a physician and a surgeon. And surgery also is very clean and neat. So sir was talking about how you're bathed in blood and things like that. We don't even see blood anymore. Our surgeries barely last 10 to 15 minutes. The longest you can go is 2 hours. Okay? Aruna, give merits.
Next. You want me to put the demerits?
Yeah. Yeah, so as sir was saying, in order to earn more, you need to invest a lot. So that is how it works here. Otherwise, you get absorbed into a job, or there are numerous eye hospital chains that are opened up throughout the country. So you can work for one of them and you can be stress-free. But if you want to earn much more, it's a very equipment-heavy branch again. So, and yeah, again, because of the same things, migration going to another country after you finish post-graduation here is again very difficult. Even if you go, you might have to be a non-operating surgeon. Now, I am not going to talk about work-life balance again. I seriously think that work-life balance is with us. Like sir was saying, I am not going to see scans after 5. It is all with us, what we want to do. So, that's what I think about that. Yeah. Next. Okay, I think you've got a gist of what you need to be a good physician. The only thing I would like to add is that perhaps you need to have a good set of eyes and a good set of hands. You've heard about being a surgeon, you have to have a lion's heart and a horse's legs. Here you don't need horse's legs, we are sitting most of the time, and surgeries are short. So basically, but a good vision, stereopsis, having a good eye test before you take up ophthalmology is a must actually. Yes, that's all I would like to say.
To satisfy anybody's needs, we have scopes, we have Illy's fixators. I don't know if you guys have seen, there is something called a Taylor-Smith frame, which is all about tech. So tech is there. There are a lot of what we talk of as interesting things. If you're not decided whether you want to take up orthopedics as a surgical field, or if you have decided not sure whether you want to take up a surgical field or a non-surgical field, orthopedics is for you. Much of your practice will consist of backaches, shoulder pain, people are happy. I know of an orthopedic surgeon who does not operate at all. He's very happy with just seeing OP patients and he makes enough, he's happy. You want surgery, you have surgery. Surgeries in orthopedics are not long. None of us, we are not a very patient field. All of us like to finish surgeries by about 2 hours, 3 hours. Anything over 2.5, 3 hours is considered an overlong surgery. Most of our surgeries will last an hour and a half, and that's it. Financially, I think any field is great financially. There are opportunities in every field to make money, and money is important, but personally speaking, I think if you love what you do, that is the best thing that you can have. I think we'll go on. So demerits, yes, it's a long field. I mean, it's a long road ahead. It will take you years before you really get into your stride. Practice is it's going to take a long time. Your skills will need years to develop. And as you develop, you'll get better and better. Physically demanding, yes, to some extent it is, because reducing fractures is not easy. Sometimes you need raw strength rather than technique. But having said that, it's not just about raw power. Technique matters more than raw strength. So we do have a lot of girls who are taking up orthopedics, we're happy to say, most of the time. Otherwise, it was almost exclusively a male-dominated field. High stress environment, yes. Testosterone-loaded field, that was not my thing. Madam has added that, yes, but maybe yes.
And he meant that, that's why I converted.
Yeah, medical legal issues, a lot of medical legal issues, yes, because we deal with accidents, bad accidents. So what we are able to offer the patient is not what the patient expects. Everybody expects to get back to 100% after a major accident. It is not always the case. We are not able to offer that. It is not possible to offer that. But somewhere along the line, I personally feel that if you explain enough to the patient, you make the patient understand, most of these problems tend to go away. Good fit for orthopedic surgeon, I told you. You have to love technology. You have to love doing things with your hands. If you're mechanically oriented, you are perfectly fit for orthopedics. And physically fit with good stamina, toss up, I think. Yes. So in conclusion, I would like to just tell you one thing. do not look, I mean, personally speaking, this is from a personal standpoint. I was just thinking of what influenced me to take up the subject, and what influenced some of my friends to take up subjects. And I've seen people, colleagues of mine, friends of mine, who have taken up things and not been very happy. So do not get influenced by looking at consultants. You only see the end product, or you're only seeing one facet of their life. You see them walking into the hospital, 10 different people following them, people fawning over them. Yes, you think that this is it, or this is a great field, this is an excellent field. It need not be. You do not see what is happening behind the curtain. There is a lot of work, there's a lot of hard work. In fact, they may be sacrificing a lot more. Work-life balance may not exist. It may not be your cup of tea. So please do shadow somebody. If it's an orthopedic surgeon, shadow an orthopedic surgeon for a month or two. You will know what it entails. All right. Do not just be blinded by the glamour of everything. It is not. Very rarely it is. It is like, I think it was, this was an example told to me by, I'll end with a joke. So this was an example my dad told me, who heard it from his professor of ophthalmology, Dr. C.R. Ballal, who started off with saying, what's the difference between a vision and a sight? With apologies to all the ladies here. So a vision is a lady in the evening. That is what Dr. C.R. Ballal said. Vision is a lady in the evening, all dressed up for the evening. And she's definitely beautiful. What is sight? Sight is the same lady in the morning when she's woken up without any makeup on. So do not be driven by glamour. Do not be overshadowed. Do not be misled by glamour. Look at it. Please go ahead, shadow somebody, and then take up the field.
So radiation oncology is a branch of medicine which deals with the treatment of cancer by using ionizing radiation. So what are the merits? It's highly impactful, intellectually stimulating, because you need to know a lot about medicine and physics, as well as have empathy. Good work-life balance, definitely yes, because we work most of the times 9 to 5, and we have a good communication with patients also. Evolving branch with with the technological advances, definitely yes, because we work with technology. So if you love machines, computers, and things like that, we have all our machines, all our work is with machines only. Most of the machines are very expensive. You can just imagine the way how we have invested in our hospital is around up to 18 crores. So good job satisfaction, yes. When you see patients dying or having severe pain and discomfort, by treating them with radiation, you can relieve their suffering. We had a patient who couldn't open the mouth. There is a tongue cancer, and the tumor was just propping out of the mouth. Patient was not able to swallow, not able to breathe, not able to talk, could not eat. So we gave palliative radiation with the 20 in 5 fractions. Within a month, this patient comes back with the tongue inside, able to take food, breathe, and talk a bit. So that much of job satisfaction you get in seeing these patients getting relieved from their suffering. Of course, remuneration, as everyone says, money is something which whatever your prarabdha says. So as per prarabdha, you get it, but there is good remuneration. Collaboration with other specialties. We have 2 major friends in oncology, a pathologist and a radiologist. Those, you have to be very friendly with them. So they give you good reports, your treatment is perfect. Of course, then you have to collaborate with others, like you have to collaborate with surgeons, with oncosurgeons, ENT, gynecologists, gastroenterologists. So it's basically from head to toe, all departments we need to have a good collaboration with. Coming to demerits, limited job market. As a radiation oncologist, you will be, working with only those centers which has radiation therapy machines. But let me tell you, there are around 300 to 400 cancer hospitals with radiation facilities in India right now, and our requirement is somewhere around 2,000. So there is scope. And you see, when I passed out in 1997 from Tata Hospital, I was searching for a job. I got here in AMC Mangalore, And even now people search, but they get. It's not that they don't. All our students, we had almost 6 years of students, all of them are well placed. Emotional challenges, yes. It looks like, madam said the beauty of getting a new baby and, eyesight, everything. But we do see death. It's not that death is seen every day, but those who are palliative or very bad patients, they die. And your interaction with them or your intervention to them, and you can help them to come out of the suffering in the last few minutes, gives you satisfaction. So it's not just curative treatment what matters, even palliation does matter. Extreme training is needed. Yeah, in some extent, yes. Like for example, if you need to do brachytherapy, you need to have skills of brachytherapy. Now, radiation therapy is a branch which has both medicine as well as surgical skills involved. Medicine in the sense when you plan a treatment, how to deliver the radiation, so it involves medicine. Prescribing medicines as well as a part of radiology. You need to know the CT scans, MRI, PET CT scans and incorporate them. And also surgical skills in terms of implants. So you can do interstitial implants or intraluminal or intracavitary applications under GA, and that helps you to deliver radiation doses. More reliance on technology and apparatus. If you are not well versed with physics, or you don't like technology, then this may not be the branch. But if you love technology, physics is not a big thing, not too much, but basics of physics should be understood about radiation physics to understand about radiation oncology. Varying reimbursement policy changes, yes, nowadays, a lot of schemes have come up, and cancer has a lot of, patients come under scheme, so under Ayushman or ESI, so the remuneration there may be sometimes reduced. Limited hands on procedure, so again, like if you are good in, you have skills in brachytherapy and you know how to treat with brachytherapy, the chance of your working in this field comes up. Now, who is a good fit? Those who enjoy a mix of clinical and technical work, as well as who seek an intellectual profession.
Any one of you is contemplating of taking psychiatry? Like, do you have it in the back of your mind that it could be an option? None of you?
Don't intimidate them before, but intimidate them after your...
So there's this huge, I have this huge task of to impress upon you that it's a good branch. So we'll go to the merits. So why is it a good branch? Because you get to do other things other than just practice medicine. You can have a family life. You can, if you're interested in sports, you can pursue it. You can go for a swim. You can go for a walk. You can have some hobbies. You can write textbooks, or you can have an Instagram page and keep posting videos of what you do at work. All right. So there's more to it than just practice. You can have adequate opportunities to earn income. So as you age, you'll have more patients, and ultimately you'll be making more money. The branch will become more lucrative with time, like any other branch. So you need to upgrade your skills, you need to be persistent, you need to move on. It doesn't have any much of litigation. So a lot of our patients, they don't litigate like other branches like skin and OBG. So it's relatively safe. What are the demerits? Many a times, because not of much exposure in MBBS, you may not be exposed to much of psychiatry in general, and you wouldn't know how to go about it. And sometimes patients can impose a risk of personal harm. So sometimes patients may attack, not patient party, never patient party, but patients may attack, and you need to be a little careful about that. It has huge scope in India and abroad. We have 9 postgraduates passing out every year from Muller's, and most of them get employed within 3 months. So either they stay in India, or they join a corporate, or they join a medical college, or they go into one of the private setups, but most of them get employed. So employment is not an option. So if you're looking for a branch which has a good work-life balance, decent money, good time to pursue your hobbies, and adequate, time for your family and your friends, psychiatry is the branch for you. Many a times we are impatient, we don't have time, but at least if you have the adequate nodding skills and smiling face, you can take up psychiatry as a profession. So when I joined Mangalore practice, I was the first lady psychiatrist. But if you look at our PG setup now, out of the 9 PGs who have joined, 8 are women. So like in every branch of medicine, women are taking over psychiatry as well. So there's huge scope, and I think you should contemplate about taking psychiatry. Even if you don't do well in NEET, this is one of the clinical branches that you might get.
Emergency medicine is a speciality. Okay, it is just like a medicine, surgery, and other. It's MD, emergency medicine. Critical care is different. We will not discuss about critical care. So what are the merits? It's a fixed shifts. Okay, so either 6-hour shifts or 8-hour shifts. It depends on the emergency medicine department. Here in Mangalore, I think KMC has got a very good emergency department. Dr. Jidu Radhakrishnan, you can consult him before taking a career or a seat. There is a very good work-life balance, and job security is high because everywhere emergency medicine is needed, everywhere. So if you want to take a job, almost immediately you will be absorbed. Probably you may be heading a department in some places, newer places. Okay. For example, if you go to Shenoy Medical College, or if you go to some other, you might be the only person there. So that way there's a lot of job opportunities, and pay is good. Compared to medicine MD fresh graduate or emergency medicine fresh graduate. Emergency medicine is paid far better. Okay. And super specialization is possible. Super specialization like critical care you can take, DM critical care you can take with the emergency medicine, or you can take a disaster medicine or a trauma surgery and things like toxicology. Okay. So, but plain emergency medicine is very good, very good. Okay. There is a high chance to migrate to abroad. So in abroad also emergency medicine is a lot of vacancies there, lot of demand is there. So you can go for the training there, or you can go for the work there. So both are possible. Okay. And you almost immediately have the result. Patient comes with the gasping and you treat, intubate, and so you have almost every minute you will be saving lives. Actually highly impactful in that way. So one other things like lack of private practice. So you have to be working in a department. It is a teamwork. It is not an individual work. And financial growth is limited because when you're being in a job, I mean, it is limited by the job requirement and institution policies and things like that. But you get a decent salary, much more than any other person working in that hospital. And night shifts are quite stressful because it is not that night duty is 1 or 2 cases, you just relax and rest. No, night can be very busy. So you won't have a time to think about yourself during some of the nights. Okay. And each case is quite serious, and it will take your mind, body, everything has to be occupied. So it's different. So the highly burnout rates. After some time, you might feel a little depressed, and you might feel a lack of meaning in life and things like that. I mean, that kind of mind state also you might get. And you will be dealing with most of the specialties. So each specialty will come with their agenda. So you might have to deal with them. So they may not, in an institution especially, they will not like to admit the case because they are already burdened with so many cases. So they won't admit the case. Or in private hospital, they might fight with you to take the case and things like that. And violence by patients is there. And my HOD was Dr. Shakuntala Murthy in St. John's. She is a quite elderly lady, and quite a respected person. She herself got assaulted by the patients. So it is, there is no exception. Okay, she is a very nicely speaking and very down-to-earth person, but she herself got assaulted. And who is the best fit? You don't want to follow up the patients, short attention span, just want to finish the work and go and play cricket in the evening. It's the best thing. When you get out of the work, you just switch off the mobile. No one is going to call you. Okay, and it's more of physical work and reflexive thinking. You work more and you become better. Okay, readings is there, but reading each disease you read 2 pages, 3 pages. You don't read books and books on each disease. So it's slightly different. So if you're bad in theory, memorizing, you like to work and extrovert kind of thing, so it's the best fit. And you have to be hardworking. There is no this thing for that. Okay, you have to be very, very hardworking during your duty hours, on your toes. If you are not hardworking, your management will know, your colleagues will know, and your patients will know. Okay, so you can't, there is no escape. So if you want to be predictable, suppose you want to plan a movie in the weekend, you can do that, because you have to just adjust your duty. If you want to go for some party or some function, someone's marriage, adjust the duty and go. So that way is very, very predictable. And a lot of opportunities are coming, a lot of PG seats are coming, and it's a very good branch to take. Think about it.
The merits of being a family medicine, some of you might not have heard of it. It's more like a GP practice, but a little bit specialization in that. It provides continuous and comprehensive healthcare to all in the community, and there is no limitation of age, sex or organ system or disease entity when you come to seeing patients. Those who can have, usually family medicine people will have a special connect and impact on the whole family unit, and they tend to become an advocate and go-to person for the family for all health related problems. There is much scope in abroad too, is what I have heard. The demerits would be they might not be as much valued or sought after as specialists. We have allied patients telling that, oh, you are not a specialist in heart, refer me there, refer me here. They have to bear the high expectation of the family to solve all problems, not just health problems. My daughter is not ready to marry, can you advise her? These kind of things. Home visits are expected by family medicine people. May get unwarrantedly involved in family disputes, legal issues, social issues. There are limited vacancies for such posts in academic settings. So who would be a good fit to be a family physician? Those who can be patient-centered rather than disease or specialization-centered. Those who can understand the context of the illness rather than the pathology behind the illness. Those passionate about health advocacy, prevention of illness and wellness promotion. Those who see themselves as a part of community-wide network and not just like a doctor. Those who can reside in the same domicile of their patient community, and those who can be a manager of resources and be a lifelong learner.